all this make sense? Okay. This is how the unified protocol comes into play. When we are targeting these different techniques, we are seeing less of the pathology in our clients, and we're seeing that the research shows us that they're moving further along in that treatment process without having to necessarily diagnose them. Again, there's nothing wrong with diagnosing, but when we come to not necessarily focusing, okay, so this is exclusively depression, but we see it as more of, this seems to fall within the general idea of what happens in grief, and we are helping them be attuned to their emotions, to be attuned to their thoughts, to be present, to have a different lens of viewing things, to create different circumstances for their physicality so that they can process things in that way and be exposed, again, to those emotions through ACT or whichever. The reduction of the symptoms tends to be more effective, and it tends to last longer than with the regular therapeutic treatment approach. Make sense? So just something for you to consider within your toolbox. And what we're going to do to wrap it up is we're going to, what are we doing, Jillian? We are going to do an interactive interview between Jillian and I. Let me switch to that page. To help bring out, yes, to help bring out what we've highlighted. Okay. It goes to there. Okay. So I'm going to be the therapist asking Eric certain questions. Well, Eric, we're coming to, your last session with me and this therapy, and I wanted to check in with you to ask you, how have you done with the goals that you set?
Yeah, well, I guess I came to realize that this loss is real and it's painful and that I'm not alone. And I realized now that my wife is struggling too, and maybe we could look at how we could mourn or grieve together, and that maybe I need to be a little kinder to myself and give myself a little slack.
Excellent, excellent. I definitely noticed that as well, how you made progress with those goals. What can you tell me in terms of how you came to understand your emotions?
Yeah, I think that handout you gave me was impactful, just learning that we all have emotions, and when I kind of thought about what I was feeling and how it all broke up, it kind of made sense to me.
And I noticed that you changed your perspective on your emotions and you were able to stay in the present. What was that like for you?
Yeah, I didn't really like that. It was hard to do, but you pushed me to do it, and I really realized that I wanted to avoid them, and that's not necessarily healthy to do.
Okay, so what skills did you learn to help you regulate?
Yeah, one of the things I learned is that jumping to conclusions is something I do, and always thinking the worst, and that's actually not very helpful. So when you gave me homework to think of alternatives, that was hard, but it really helped me see how my emotions were changing, the way I was thinking about my future. And then once I realized that, I could start to really see a different future for myself and my family.
I noticed that you were definitely rewriting your story, and there was a greater sense of hope for you. Good, good, good. Yes, I think that was it, right?
Yeah.
Okay,
And
now I'm getting carried away. I want to ask more.
Now I get to interview you about your success as his therapist.
As his therapist,
Yeah.
Okay. I'm
So.
a star.
So, Sharon, as Eric's therapist, how did you know he needed multiple sessions?
Well, I saw the relationship between his grief and some of the trauma that he seemed to be presenting with the different losses.
How did you find that out? How did you come to see that relationship?
I did a comprehensive assessment that included a perinatal grief scale, which I did twice during our time together. And he was also sharing his subjective experiences as to how he was doing with his goals. So those check-in points were helpful. As I gathered that medical history in my initial paperwork, I noticed that what he was presenting would require more than one session. So that group therapy approach was helpful, and a key component was taking my time and gathering all the information I needed.
And I think you did a lovely job at that. So how did you use that approach of companioning with your work with Eric?
You know, I haven't had a client with his cultural background before, so it was important for me to convey to him that I wanted to learn what his perspective was, and that I was going to try my best not to assume what any norms of just came along with his interpretation of laws and how that's carried along. So I was very conscientious about not coming across with any type of microaggressions, and again, checking in with him to make sure that I understood him was important.
I think it seems like he felt safe to move forward with you, so I think you did a nice job. How were you conceptualizing his case?
Well, I learned about this unified protocol, this amazing two ladies. I did follow a unified protocol to help me apply my interventions, and used evidence-based theories such as positive psychology and emotion focus, as well as the tasks of grieving with Warden, whom I particularly like, to see that his grief was delayed and where he fell within, a possible diagnosis, although I really avoid giving those because I don't have to bill, so I can kind of get away with it. But definitely notice that it was important to teach him how to accept his emotions, and later how to regulate that, but constantly assessing how he was coping with this situation.
Well done.
Okay. All right. So a little less interaction this second portion in terms of getting you to do your role play, so maybe we'll adapt. But this is what we're hoping you will walk away with today. Certainly really understanding the core of that relationship with your clients, coming from a cultural humility perspective, showing that sense of curiosity with them, understanding that there's no one way to really intervene with your clients, but that eclectic approach is helpful as you meet your clients where they're at, to avoid the assumptions and any possible judgments, to check in with yourself in terms of what you can offer, what kind of safe place you are for them, and checking in with yourself about your own self-care as well. Understanding that we do our best when we work within our scope of our practice, and that it's okay to say no to certain clients when we can't meet them where they're at. So hopefully understanding how thorough really that comprehensive assessment is over time can help you understand and conceptualize your client's grief more, and understand that there's a lot more of the grief therapy that can be involved in this process. Anything you want to add?
I think just that piece of thing that I like about the Unified Protocol is you can really take whatever tools, you see a lot of familiar words out there, concepts, right? And so whatever it is that you're trained in, you can use that to help kind of move through that, but that it can be transdiagnostic and really kind of addressing multiple issues at once. I know our EHRs are not necessarily set up to accommodate that, but we are kind of treating a whole person here, and I like the Unified Protocol because it really does look at the person as a whole person.
So if you haven't checked on our materials, please do. If you want to purchase anything, you're more than welcome to, but also use our websites as a reference to your clients, abortionchangesyou.com, miscarriagehurts.com. If you want to reach us, we have our contact information there as well. And keep your eye out for Change version 2. It's not called version 2. What is it called?
The second edition.
A second edition,
Yeah.
thank you. I'm looking at the right language. Second edition. I'm looking forward to it. And any final questions, comments for us? Was this useful? Can you see yourself implementing this with some of the tools that you hopefully take from today. Yes? Wouldn't bore you to death, so that is a success on our part. It's harder the second, right? The second portion. So kudos to you for completing your 6 hours. Do fill out your evaluations and do see Mike Lean for those certificates.
Definitely. And I had, there was a couple people who asked about the patient information sheets and that were in your reproductive loss in 101. When we do, we'll email you a little follow-up and there'll be the PDFs for those. So if you want to use them, because people do find them helpful, just feel free to, then you'll have a good copy, you'll have a good version and you can just copy them and use them. So,
Thank you. We'll stay